Hi, good afternoon, everyone. It's great to see so many of you joining us today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. I hope everyone has survived the time change this weekend. It's always a little nicer whenever you get an hour. And we also have a big election coming up. So I know as anxious as many of us are, it's been really good to see the turnout so far, and I hope everyone's taking advantage of early voting or has a plan to vote tomorrow. For those of you who are joining us for the first time and may not be familiar with Thrive Kentucky, we can go to the next slide, Alex. Our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians have faced historical or systemic barriers to meeting their basic needs. You can see the guiding principles that we use to guide our advocacy work on this slide. And on the next slide, you'll see the campaign members. You can click on any of those organizations when you get this slide deck and learn more about our organizations and the work that we do. We can go to the next slide. We always want to say a big thank you to our 2024 sponsors for supporting this work and making it possible for us to provide these updates and our forums and trainings for free at no cost to all of our participants, and also to cover CEUs for CHWs for certified community health workers and for social workers. So we really appreciate that support, and we are taking sponsorships for 2025. So if you're interested in learning more, you can reach out to Kelly Talby, and she can put her email address in the chat. And if you haven't already joined us for one of our Thrive Kentucky roadshows, which is when we come to your community and do a longer presentation, more updates, some advocacy training, all in person, which is a really nice change of pace. We will be having our last in-person roadshow in Louisville on the 19th of November, and we'll also be doing a virtual roadshow in December. So more information there. Let's go to the next slide. Here's the agenda that we'll be covering this afternoon. This year has absolutely flown by, and it's actually been 5 months since we hosted our last forum with the Cabinet for Health and Family Services. So we're really looking forward to getting the latest updates this afternoon. And we are delighted to have on the call today a number of folks from the Cabinet. I believe at some point today, the Secretary Eric Friedlander will be with us. Deputy Secretary Carrie Banahan has joined us. Medicaid Commissioner Lisa Lee, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, Medicaid Deputy Commissioner Leslie Hoffman, Acting Director in the Division of Healthcare Policy, Justin Derringer, Department of Behavioral Health and Intellectual Disabilities Executive Advisor to the Commissioner, Ann Holland. That one was a mouthful. Department for Community-Based Services Commissioner Lisa Dennis, Assistant Director of the Division of Family Support, Wendy Cumpston, Director of the Division of Child Care, Andrea Day, Department for Aging and Independent Living Commissioner, Victoria Elridge, and Department for Public Health Deputy Commissioner, Dr. Connie White. We really appreciate all of them taking time to join us today and to share information about things that are changing, things that are upcoming. As always, our goal for these forums is to create more open dialogue between Cabinet leadership, consumers, and advocates. And we really want these webinars to be an opportunity for you to get updates on our safety net programs, share feedback, and ask questions. So during each section, be sure to put any questions or comments that you have in the chat. We try to cover those as we go. If there's something we don't get to, we will include it in a follow-up email. And just a little bit of housekeeping before we begin. We do have a lot of folks on the webinar today, so please be sure to mute your line and use that chat box if you have anything to contribute. We are recording the webinar. We'll be sending out a link to the recording along with any materials and an evaluation in a follow-up email, so watch for that tomorrow or Wednesday. And if you are a certified community health worker or a social worker and you'd like to receive CEUs for attending today's webinar, please be sure to complete the evaluation that you get in the follow-up email. And with that, we're going to get started by sharing some breaking Medicaid news related to Anthem's contract, which has been in litigation for a number of years until last week when a final ruling was made. And we learned this morning that Anthem will no longer be operating as a Medicaid managed care company starting on January 1st, 2025. So I wanted to just pass it to Deputy Secretary Carrie Banahan and Commissioner Lisa Lee to share some more information with us about what we can expect to change and what Anthem members in particular need to know?
Thank you, Emily. I am Lisa Lee, Commissioner for the Department for Medicaid Services. As Emily said, beginning January 1st, 2025, Anthem will no longer be a Medicaid managed care option in Kentucky. We do have a transition plan to make sure that all of our Medicaid members are transitioned to another managed care organization. It should be seamless to them with no gaps in care, no gaps in coverage. We do have a transition plan developed. We will have communication that goes out both from our DCBS offices and from Medicaid to make sure that everyone understands their options and when they can select or when they will be reassigned to a new MCO. And I would like to note that Medicaid used to have an open enrollment for Medicaid managed care organizations, but it always coincided with the open enrollment for Connect and then Medicare. So CMS has said, as long as we have a process in place for individuals to change their MCOs, we no longer have to have that open enrollment process, which is a good thing right now, because when we transition individuals to a new MCO, they can also call the department, call other agent, or call our numbers, or work with the connector to switch their MCO if they want to prior to that January 1st date. Because that is always an option for our Medicaid members. But if you would like a little bit more detail or have questions, I'll turn it over to Senior Deputy Commissioner Veronica Judy Cecil, and she is going to be spearheading this transition for our members. So Senior Deputy Commissioner, if you have some more information you'd like to relay to this group that may be of importance as we move forward.
Thank you. I think maybe just to add a couple additional level of detail, we are going to run a reassignment. The members, in order to really try to effect a smooth transition, as opposed to using the 5 remaining MCOs, we are going to reassign to just 2, and that will be Humana and United. They will be reassigned in an equal distribution between the 2. As the commissioner mentioned, a member will always have the opportunity to change their MCO if they are not pleased with the MCO that's been reassigned to them. We have a website that we established, Kentucky Medicaid Anthem MCO Transition. If you Google that, you should be able to find it. We're going to really start populating it with information that's helpful to folks. There's already a frequently asked questions document on there. I certainly ask you all, if you take a look at it and you think there are some gaps in information or questions, please share those with us. You can email them to me. We'll get them added because we want to be as robust as possible in the information that we're sharing. It can be from the member or the family or the provider perspective, any of those. And, the last thing to note is the member will be made aware of the reassignment by a member notice that will go out November 12th. So the reassignment will happen on the 10th, and then they'll get a mailing that goes out on the 12th. So we know this is going to be a big change for folks, and we really are focused on especially those individuals that have they're in care management or disease management, inpatient, maybe in residential care, anyone who's pregnant. We're going to be really having the MCOs. We're going to be looking for those individuals and making sure that there is a warm handoff for anyone that sort of needs that extra help in that transition.
Thank you for those updates, Veronica. And I wanted to also recognize Bev's comment in the chat that there are some particular clients who have benefited from a housing pilot that Anthem has been managing. And it reminded me that I think it's important for us to all remember that this litigation was about the RFP process and the selection process, and not about Anthem's quality or the way that they've been delivering services. And so, if anyone hasn't been following this litigation, which really has been going on for a few years now, just know that this wasn't about Anthem not performing. It was just about a contract dispute. And so unfortunate that it's come to having to switch these members. But I appreciate all the thought you're putting into making sure the transition goes smoothly and that people are going to be having a choice ultimately, even if they are auto-assigned, that they can select another MCO at that point. Any other questions, Priscilla or Dr. Schuster, as far as the Anthem contract goes?
Veronica, can people switch without giving a reason? What's that process like?
Yeah, we have continuous open enrollment,
Okay.
and I know that's on the agenda for the meeting, but we are going to maintain that continuous open enrollment for Medicaid.
Okay.
This is specific to Medicaid, so members can change their MCO at any time without cost.
Great, thank you.
And if I could just add to that, during the times that we did have open enrollment for managed care organizations, we did monitor the number of individuals who would select a different MCO during open enrollment. And one of the reasons that we have decided to just have continuous open enrollment is less than 1% of our members actually switch. So we just want to make it clear that our members do appear to be happy with the current MCO that they have, and we do not see a lot of members changing MCOs throughout the year. Even though they can, it's a very, very small percentage that actually change their managed care organization.
Gotcha. And I'm sorry, my Zoom just quit on me really quickly, so I'm sorry to have missed this start of your answer. But I did want to just clarify. So the MCO, like the open enrollment process for switching MCOs, that has been done away for up until the end of December. Is that going to still be the case moving forward into 2025? It's just going to be an open, folks can change their MCO at any point?
Yeah, that's correct. We're going to maintain continuous open enrollment through 2025. Mm-hmm.
Okay. Is that just through the end of 2025? Is that something that you're looking at maybe doing it with all together moving forward? Or is this like just through the end of 2025, another year to sort of extend that flexibility?
I think we continue to monitor because we get a report that's a weekly report about MCO changes, and we just continue to monitor it. And, I think, and I'll defer to the Deputy Secretary or the Commissioner, but, I think as she mentioned, we think it's valuable for folks to have that ability and not have to go through some onerous process to request for a cause change. And it has been confusing for open enrollment for the health benefit exchange. So, I think it's been a win-win for everyone. And so I think it's something we'll be maintaining for a while.
That's really exciting. I know that I've heard from a lot of clients that it's been a lot easier this year to be able to switch around, and not that they do it often. Most folks are not switching MCOs multiple times a year without, there being some sort of precipitating thing. So that's really exciting that that's going to continue for another year, especially with now Anthem, that transition. I know you said that there's going to be a member letter that goes out to members specifically. Is there going to be any communication to, say, connectors who might have helped them enroll? Here's maybe your list of clients that were affected, or a copy of the notice? What sort of additional education is going to be available there?
Absolutely. So I know a notice went out to connectors today to make them aware, and included the FAQs, which we really kind of want folks to lean on for questions they may get. And that's why it's very important as you all come up with new questions that we get them added. We are, once the letter is going through its process to be put on the letterhead and make it, look like it normally looks, so that we will be posting what that letter looks like, and we'll share it so folks know what members are receiving.
Perfect. That's so helpful. And that FAQ, we walked through that earlier today. There are a lot of great questions already filled out in there. I'm so glad. Thank you for sharing that. And we'll keep an eye on the chat, but are there any other immediate questions about this? Otherwise, we'll kind of move on to the rest of our section. This is it's a big update. We've been waiting for it for a while, so I appreciate the thought that you all have put into this plan and helping consumers. So, all right, well, with that in mind, let's move on to the rest of the section. Veronica, or Deputy Commissioner, since you're already talking, let's go ahead and move on to the back and some other Medicaid-specific updates.
Thank you. Oh, do you want, as far as the back is the Beneficiary Advisory Committee, many of you may know that CMS issued some final rules related to Medicaid. It impacts several areas within the Medicaid program. One of those being that we need to create a Beneficiary Advisory Committee. That committee has to be made up of former Medicaid enrollees, their families, and paid and unpaid caregivers. The purpose of this is just it's intended to create an environment where Medicaid members can speak freely about their experiences and have input into the Medicaid program design. And the membership of the BAC, one thing that is going to change with our current Medicaid Advisory Committee, or our MAC, is that MAC will have to now have by, I think it's by July of 2027, we'll have to have 25% of the members on the MAC will have to come from the BAC. So what we are doing, we currently are working with the vendor to help us work through all of the final rules and including the creation of the BAC. So what we've been thinking a little bit about, we've been participating in several national meetings and information sharing sessions related to what other states are doing. We do have a template for outreach, because the final rule does say that the Medicaid director has to select the BAC members, not appoint, but select. And currently, we do have about 17 technical advisory committees. One of them is the Consumer Rights Technical Advisory Committee. And so as we've been having discussions and looking at some of our options, we know that we can, if we have an existing infrastructure, we could use that. So nothing has been finalized, but one thing we are thinking about is repurposing that Consumer Rights Technical Advisory Committee to be the BAC, and to start those conversations with that committee to get their thoughts on that, to see if they feel like that would be a good fit, because it makes sense to have, you know, a BAC, a Beneficiary Advisory Committee, would be the same as the Consumer Rights Technical Advisory Committee. They would be sharing some of the same members. So that's one option that we are looking at. So I really think that the conversation would be very beneficial with the Consumer Rights Act to start that conversation now. If we decide to use that existing infrastructure of the Consumer Rights Act, then we would need to do some legislation, because the Consumer Rights Act is in a KRS, it's in a statute, as well as the Medicaid Advisory Committee. So once we get all of those informations and we start developing that, definitely want to involve the Consumer Rights Act and the Medicaid Advisory Committee on how this looks as we go forward. We have to have this in place by July the 1st of 2025. So again, we think repurposing that Consumer Rights Act would be very beneficial to helping us establish that framework. And I know, Emily, you're chair of that tax. So this hasn't been discussed. This may be new news to you, but again, just something we're thinking about. Haven't made that final decision. So definitely want to take that to the Consumer Rights Act and start those conversations.
Thank you for that. For Wow, sorry, lost my question. Is there an opportunity for folks to get involved or to share feedback, one on both the design before it's been transitioned or before that legislation goes into, before you start talking about what that legislation looks like?
Absolutely. I think, at that we will rely heavily on our Consumer Rights Technical Advisory Committee to help us formulate all those in the communication processes. We will be, like I said, we do have, that's one thing that will definitely lean heavily on our Technical Advisory Committee and our Medicaid Advisory Committee is how to get that word out there. What does this look like? And because the Beneficiary Advisory Committee, 25% of those individuals will also have to serve on the MAC. So this has to be very well thought out about how we incorporate those individuals, not only as a Beneficiary Advisory Committee, but within our Medicaid Advisory Committee. So those conversations, I think, need to start happening now. And as soon as we get somewhat of a framework, and particularly as we're looking at legislation, we want to have input from those committees that are already familiar with the Medicaid program, already advising and looking at the program policies and procedures.
I might add, I talked to Commissioner Lee earlier today, and I chaired the MAC, the Medicaid Advisory Council, and we will have this on our agenda for our November 21st meeting. And those meetings are open to the public, so you will be in on that. But we definitely want to include the discussion from the MAC members, and that includes all 17 of the Technical Advisory Council members as well, committee members. So there is that opportunity, I think, for some more discussion and more fleshing out of some of these ideas. We also talked about the need for technical assistance for members of the BAC. You know, when you bring members, Medicaid members or their caregivers or their family members on, there's a lot to learn about how these organizations work, and it can be very overwhelming. We've seen that with some of the members of our tax and even of the MAC, and we need to look at who would be in a position to provide that technical assistance and support, and keep people, feeling like they are making a contribution, but that they kind of know what's going on. So those are some of the things we've talked about as well.
Yeah, that's a great point, Dr. Schuster.
And another point is that the BAC members have to be selected. So there's going to have to be a selection process. So in some way, we're going to have to get some applications from the individuals, not only the members, but again, the makeup of the BAC would be current and former Medicaid enrollees, their families, and paid and unpaid caregivers. So that selection process, I think, needs to be very well thought out and vetted, as well as terms, the number of beneficiaries, knowing that 25% will have to serve on the MAC. So there's a lot of thought that needs to be put into that makeup. And I think, as Dr. Schuster said, the Medicaid members who have not been intimately involved with the Medicaid program, it could be a little overwhelming. There are some toolkits out there by some national organizations. CMS was supposed to come out with a toolkit also during the latter part of 2024. That has not been put forth as of today. So we continue to wait on that toolkit to kind of help us as we move forward. Of course, we do have some resources, and knowing that the General Assembly will be in town and it's a short session. If we do decide that we definitely need to file legislation, we need to get that done now so that we can be in compliance by July of 2025.
That's super helpful. So it sounds like the next steps are going to be conversations at the Consumer Rights TAC and at the MAC. And for folks who are interested, join those meetings and they can participate in some of the conversations, hear what those conversations are, and sort of share feedback that way. Is that right?
That is correct. And we, really just know that our TAC and our tax and our MAC are so valuable. And I think that, going back to the notice improvement project that we worked on with them, I really feel like that their voice is definitely instrumental in building out this framework for the MAC and the future of the MAC. So we look forward to working with them.
Okay, that's super helpful. Thank you for sharing that. Let's move on to our next topic because we have a very stacked Medicaid section. Let's move on to the status of child renewals. I believe
just a brief reminder for folks to refresh memories, we currently have, as part of one of our flexibilities for unwinding from the public health emergency, the automatic extension of child renewals for 12 months. That flexibility is continuing. As of right now, those flexibilities in June 2025. So all public health emergency unwinding flexibilities end in June of 2025. So we anticipate that this child renewal flexibility would also end at that time. We still have not heard from CMS to end the flexibility. There was some conversation and we had asked for it to be extended, and until we hear otherwise, that is the continued plan for Kentucky.
Okay, and so for right now, the reminder to families and is that make sure that their contact information is up to date. But regardless, we do expect those renewals to happen by the end of December 2025, and they may restart maybe June, but that part is still up in the air.
Right. Yeah. If the flexibility ends in June of 2025, that means renewals starting in July of 2025 children might actually have to go through an active renewal.
Okay. And then you would do the 600,000-ish, you process those renewals between July and December.
The renewal, the month of the renewal does not change for a child. So,
Okay.
Any child that's been automatically renewed up through June will maintain that renewal month. We would just be starting with July renewals from that point forward.
Okay,
Oh.
that's interesting.
Yeah.
That's also really helpful. I think we were imagining the same process as with adults where they'd have to be batched and to comply with a specific timeline, but that is much better.
Yeah, they'll maintain their renewal.
Yeah.
Their renewal month.
That's awesome. That's a great update. Okay. That definitely opens things up a lot more for families, that they would really only be looking for it July moving forward. So that also simplifies things. Thank you for that. Okay, well, a reminder to families, keep your contact information up to date. But children should not, unless they turn 19, move out of state, pass away, the parents ask that they be disenrolled, or we've also heard cases of folks receiving RFIs that they haven't responded to. Those are still all valid reasons why children could lose coverage, but nothing outside of that. You muted yourself.
That's correct. And continue to escalate, any cases that might fall outside of that we're happy to take a look at them.
Perfect. Awesome. Well, thank you. That's a very exciting update and more, a little bit more than I thought I would be hearing today. So thank you. All right, let's keep it moving. The next would be, oh gosh, I got myself all out of order now. Let's go on to the NEMT and talk about some updates there. And we have Justin Deering here to talk about NEMT.
Thank you very much.
Hello.
I'm going to share my screen. My name is Justin Deering. I'm the director for the Division of Healthcare Policy. So let me see. Can you all see that?
Yes, we can.
Awesome. All right. So we'll just cover some quick non-emergency medical transportation basics because it is a program not everybody really knows about. So Non-emergency medical transportation is for Medicaid members who don't have access to their own transportation. It provides transportation for Medicaid recipients to and from Medicaid-covered medical appointments and procedures. It also provides transportation to and from the pharmacy for Medicaid members for prescription pickup. It's administered by the Kentucky Department for Medicaid Services, and we contract that through the Transportation Cabinet, and it's not under the managed care organizations. It also has to be a medically necessary service, which all Medicaid services have to be. For eligibility, all Kentucky Medicaid recipients are eligible except for individuals that have a vehicle registered in their name. Again, those services have to be medically necessary. Free transportation can't be available to that recipient so that they qualify for the NEMT services. So we had some changes for eligibility. So Administrative Regulation 907 KAR 3066, which is Medicaid's administrative regulation for NEMT, was amended, and those amendments took effect June 2024. And some of those highlighted changes we're excited about because it gives them more access to individuals for non-emergency Medicaid transportation. And the biggest one is for recipients' eligibility that went from vehicle in a household to no vehicle in a recipient's name. During the public health emergency, we had a lot of individuals that lost jobs or that were looking for housing. And then with the increase in house prices, the increase in rental prices, a lot of people have moved in with others. And so we saw a need for individuals to be able to have access to vehicles, even if they were staying with someone during that time. So we made that change. And now instead of having a vehicle in a household, deny you from the ability to use non-emergency medical transportation, you have to have a vehicle actually registered in your name. So other changes that are a big deal are now narcotic treatment programs have transportation available to them. So any individual that's on Medicaid or medication assisted therapy using methadone has to go to a narcotic treatment program for care. Most individuals that enroll in these programs are in phase 1. They have to be at the narcotic treatment program 6 to 7 days a week. And so it's difficult to get transportation services if you don't have a car. And so now with the administrative regulation change, Medicaid individuals or individuals on Medicaid will now receive transportation to the narcotic treatment program. Parents also are now able to request a 2-week exemption for NEMT services. So if a parent has a child that is a Medicaid recipient and they have a medically necessary appointment, even if that parent is exempt for some other reason from the program, they can request a 2-week exemption for that child to the Transportation Cabinet, and that can be approved for that child. So in order to get be exempt from that vehicle in your name policy, recipients that have that vehicle in their name need to get a note from a clinician, from a school, from an employer, mechanic, or the transportation authority saying that that individual can't use that vehicle for transportation for whatever time period. Now, that will allow them to be able to still use non-emergency medical transportation services, even if they have a car registered in their name. So the notes, again, have to say that the vehicle is unusable for the recipient. Recipients that are under 18 have the same vehicle ownership status as a parent or legal guardian. And again, that's where that 2-week exemption for children comes into place. So even if a parent has a vehicle, if they need services for their child for some reason, they can still get that 2 weeks to be able to have transportation for their child. So how to access services, the Kentucky Department for Transportation, which contracts with us, has brokers for each region. Each one of those brokers has a toll-free number, and there's a list of brokers on this particular website. And so I think we've sent everyone on the call a copy of the slides that has that website. So each broker has a toll-free number that you call and can get services. There's also a denial of services hotline. We added this a couple of years ago when we had some issues with some people that were denied services. So anybody that is denied services has a separate number that they call, so they don't have to call the actual regional broker. They can straight call this hotline that goes to the transportation cabinet for any denial of services. There's also a complaints, comments, or concerns number. It's 1-888-974-RIDE. And so that number is a number where if you have a complaint, if you have a question, concern, comment, again, you can bypass that broker immediately and you can go straight to the transportation cabinet for those issues. The reservation line's open Monday through Friday, 8 to 4:30, and on Saturdays as well. And so services usually provided 6 a.m. to 8 p.m. On Saturday from 8 to 1, and they are closed on specific holidays.
And Justin, there was a question in the chat I wanted to ask real quick. A question about the exemptions. Can you only get a 2-week exemption a year, or is it 2 weeks at a time and you can get an exemption more than once a year?
So you can get exemption more than once per year. There's not a specific limit as far as how many that you can get. So they can send that in as needed.
Okay, awesome. And then another question about who initiates the narcotic treatment transportation process, provider or patient?
It could be either. So we have encouraged providers to reach out. We've encouraged community health workers to reach out. So it can either be the provider or the Medicaid recipient could reach out and call the broker to set up those services. We do not allow providers to solicit, so they can't, like put up advertisements saying you need to use this service or whatever. But if individual needs transportation, we encourage providers to set up patients to be able to get these services, and we oftentimes have them to provide handouts for individuals that don't have those services that are needed.
That's helpful. Thank you.
So again, we contract with the Kentucky Transportation Cabinet, who in turn contracts with regional brokers. Now scheduling, there's a 72-hour notice required when scheduling. So just like a doctor's office, I can't seem to get into my doctor's office the same week I call, but it's similar. So they have 72-hour notice to try to schedule a doctor's appointment. And so they'll be in that area that the provider is in, or the nearest closest area. And that's defined as a Medicaid recipient's county of residence or contiguous counties. There is also an urgent transport line, which is important. So urgent transport is available 24/7. So it's not constrained by the other times and dates. It's open 24/7. So if an individual has a specific urgent care need, but it's not quite ambulance or emergency room visit, then they need to be seen within the next 12 hours or so, they can ask for this emergent or urgent care transportation, and they would call the same exact number that they would call for the regular broker toll-free number, but they would request the urgent care transportation. So the brokers are responsible to verify the recipient's eligibility, to assess the recipient's need, educate the recipient, determine the appropriate transportation mode. They're also responsible for vehicle maintenance, inspection, and operation, the driver's qualifications, training, drug and alcohol testing, and they also have compliance tracking and safe and timely services. We get a lot of, and I say we, mostly those go to the transportation cabinet. We do get some complaints, and we try to investigate each one of those complaints. We consider this a customer-centered process. A lot of times the patients will complain that they were denied a ride. Maybe they had a child, but they didn't have a car seat. And so if they would have shared that they needed that ahead of time, we could have had that covered at some point. But there is the complaint line, state and regional levels, a toll-free number complaint line. As you can see, we've had in the state fiscal year 24 over 3 million Medicaid trips just in 24, and only 9,900 denials for ineligible trips. So a lot of trips, not that many denials. We also do a rider survey were on that rider survey for state fiscal year 23 was a 97.6 customer satisfaction rating, which is extremely high. You can see there's 16 different regions in the state of Kentucky that we use for non-emergency medical transportation. So that's, does anybody have any questions? I'll stop there for non-emergency medical transportation.
So it does look like there are a couple more questions in the chat, and I hate to cut you short, but we are running low on time. I know that you've already shared the slides, and we'll make sure to send those out as well. If folks have more questions, please put those in the chat. And Justin, if you're able to hop in the chat and answer those, or we can collect those questions and also send those to you.
Sure.
We can answer them and we can send those back out via email.
Yeah.
But thank you so much for joining and sharing that update.
Well, and real quick, I wanted to say that on attached to those slides that everybody's going to receive is the travel reimbursement program. It's a separate program, but it's also a very useful program for individuals that need transportation and Medicaid services. So be sure to look at that, and I'll answer any questions in the chat. Thank you.
Awesome. Thank you so much for sharing. That's so helpful. We get questions about NEMT all of the time, so those slides are going to be invaluable. And we'll make sure to send those, share those out. So moving on to our last two things pretty quickly. We have waiver updates, and I know Dr. Schuster had a question about the SMI waiver.
Thank you, Priscilla. And I've asked Ann Holland, who is the special advisor in the office of the Commissioner of the Department for Behavioral Health, Developmental and Intellectual Disabilities, formerly in Medicaid, and she's spearheading the severely mentally ill state plan amendment. So it's the SMI SPA. And my question, Ann, is there are so many people that have been waiting for CMS approval of this SPA, and you've been very good at reporting back to us. The last I had heard was that they had asked some questions and you all had responded to them, and that started, as I understood it, the 90-day clock again. And I believe there's been yet another set of Q&A from CMS to you all and then back. So my question is, what's our latest best guess about when we might see a CMS approval of the SPA?
Thank you for inviting me. And we are still in active discussions with them. I can't predict a date, but the discussions help to, once we get all their questions answered, then we might look for an approval shortly after that. So don't have a date, but we're still in communication with them. Okay. And we have responded, and they've sent some more questions, and we're working on those responses. What else was on here was, what is the updated timeline? We are still projecting to begin 7/1/2025. We are working through regulation drafts. We're working with DMS, of course, as a partner here too, on anything that would be required with the systems, provider type development, those kinds of things. So we're still moving and pushing, and the date has not changed. We're still going active at July 1st, 2025, at least today.
I think that's reassuring. As you know, we've been working on this some of us have been working on this for 20 years, so we are a little bit impatient, but that's good to know that you're in constant communication with them, and that doesn't, I was picturing that it kept setting the clock back another 90 days when you're in communication. No. That's wonderful. So thank you very much for that. You're welcome. Of course, you'll let us all know as soon as you get some approval from CMS. I think, the Schuster rule is that you celebrate any good thing that happens with anything you're working on, a bill or a waiver or whatever. So I think we have to have a party when that happens, and then we'll work on implementation. So thank you very much. For those of you not aware, that SPA would give residential supported services to people with severe mental illness, and a whole range of heretofore not given services for people with severe mental illness and those with substance use disorders. So including for families of persons with severe mental illness, respite for the families, which they have never had as part of any program. So some really good things in this. Thank you very much. We had a question about the reentry waiver, and I don't think that Angela Sparrow was able to get on. So Commissioner, I don't know that our question was, and I think I'm right about this, that the implementation plan had been submitted.
Yes, the implementation plan has been submitted.
Yeah, and I guess the question is, since again, we have a TAC that Steve Shannon runs for the reentry waiver. Is that implementation plan public information? Has that been made public?
Yeah, I believe it is, but I will go back and check. And it was just submitted late last week. So let me go back and double check. But I believe it is public document, but I'll double check on that.
Thank you. And I would say just communicate with the reentry TAC if you don't mind, and with me. You know, there's so much interest in that waiver because I think we're really looking at a huge number of Kentuckians coming out of prisons and juveniles coming out of the juvenile detention center. So thank you for that. The other thing, and I thought that Leslie Hoffman was going to be on, but I don't see her on. We had asked for an update on waiting lists on the HCB waivers, and she may need to send that to us as a follow-up because we've not had that update for a while.
Yes, we can send that as an update. I do know that we have a report that was submitted to LRC regarding the waitlist status with some recommendations. So that report is also available.
Well, that's the next question. You anticipated it. Thank you. So that was the report that was due October 1st, I think. So where would one find that?
I believe that we can double check and see where that's at and if we can send it out. I believe it is public. It is a public document. So we can send that out and we will get that to, would it be Emily? Will we send that to you and then you could get it out to the Thrive community?
Yep, happy to.
Okay.
Yeah, that would be wonderful. And we can share it with people that, you know, participate on this forum. And then the final thing is a question that's come up from, I think both Priscilla and I had run across people that, is it possible for somebody to be in one of the HCBS waivers, to be a recipient of those waiver services and not be a Medicaid member?
No, so make sure I understand your question. So are you saying, can you just please re-ask that to make sure that I understood? I'm sorry.
Well, we were surprised, but we've come across people that are receiving HCBS waiver services, but are not members of Medicaid or not Medicaid members. And I thought that you had to be a Medicaid member in order to apply to be to get an HCBS waiver.
So eligibility, it depends. Eligibility, you have to meet Medicaid eligibility in order to be a waiver participant. You know, the waivers have their eligibility. So the waiver, being eligible for a waiver actually makes you eligible for the Medicaid program. And the best example that I can give is we do have some children, for example, who may be in families with income that is too much for them to qualify for the Medicaid program. So therefore, those children would not qualify for Medicaid. However, if they do have medical needs that allow them to be eligible for a Medicaid waiver, then the waiver goes by the child's income and they would be eligible for the Medicaid waiver. Therefore, they would receive the full Medicaid benefit package. So the eligibility for the waiver does get you the Medicaid eligibility, but there may be some instances in which an individual, and it's particularly children, who may not qualify for Medicaid based on their family income, but based on their medical condition, they qualify for the waiver, and then that gets them into the Medicaid program.
But what I'm hearing you say though, and that's really helpful to see where the eligibility comes from, but it actually is not possible to be a Medicaid waiver recipient and not be receiving Medicaid services or not be eligible for Medicaid services.
That is correct. Once you're eligible for the for the waiver program, you are eligible for Medicaid. You get a full Medicaid card. You can access any Medicaid service outside of that waiver. So we call it Medicaid is Medicaid, and then the waiver is Medicaid Plus.
Okay, that's great. And that wraps up my part on the waiver. Thank you so much, Commissioner. That's very helpful, and we're glad to have those access to those reports as well. And Priscilla, I'll turn it back to you.
Yes, well, in the interest of time, we are going to wrap up the Medicaid section and turn this over now. Thank you so much to the folks from the state for joining us and sharing so many wonderful updates. I'm really excited and glad that we were able to hear from you today. So I am going to pass this on to the next person.
Hello, it's Kelly Talby, Kentucky Voices for Health. We're going to be covering some legislative or legislative related updates real quickly for you all. And one item that I know we didn't get to touch on, but it kind of is a good segue before we get into speaking with Dr. White, the Deputy Commissioner for Public Health. And so, Secretary Banahan, if you want to speak to the pregnancy special enrollment period that is in the queue thanks to Momnibus, Senate Bill 74, I think that start date is January the 1st. Is that correct?
That is correct. So beginning January 1, pregnant women can apply for coverage through a qualified health plan on the exchange. In order to qualify, you have to have a medical diagnosis of pregnancy from your provider, and your effective coverage date would be the month of your pregnancy if you so choose. Also eligible, if the pregnant woman is eligible, are her family members. You'll be able to go out on Connect January 1 if you're pregnant and apply for coverage through the self-service portal by picking a special enrollment reason called exceptional circumstance.
Thank you. That's huge. I think it was kind of a surprise to a lot of policymakers and individuals over the last couple of years to understand that even with commercial health insurance, open enrollment seasons, Medicaid, Medicare, that there is still a population of individuals that at the time of pregnancy don't have access to coverage. So this special enrollment period is really important. Another piece of Momnibus, and to kind of pass the virtual mic your direction, Dr. White, was the doula study. It was a commission mandate through Senate Bill 74 that wanted us to more academically explore pathways for Medicaid reimbursement of doula care and services in Kentucky. And I was tickled to be a part of that advisory work group alongside you and many others. So I don't know if you wanted to share a little bit about what that process has looked like. I know you all have contracted out with Milliman, and just kind of speak to where we are, because as much as I hate to be the wet blanket here, December 1st is happening soon, and the legislature will be back in about 64, 65 days. So there's your womp womp.
But who's counting? Yes, Secretary Freelander asked me with my OBGYN background if I would help to lead this. And so I have worked really closely with Dr. Judy Terrio, Medical Director at Medicaid, with Milliman, who have great resources to do a lot of legwork that none of us have time to do. We're grateful for that. With the Medicaid contracting that, but we did start on this report. It has had multiple ways that we've been trying to collect information from across our state. We wanted to do several things. We asked Milliman to look at other states to see who else is providing doula services now. And there are 20 states, including the District of Columbia, that are now providing doula services in some form or fashion. So in the report, which is already got a draft that's being circulated right now for approvals, and so we will have that to the legislature by December 1st. So that deadline will be meetable. I don't know if that's a word, but it will. So we looked at the credentials that other states require. We looked at the scope of the visits. Is it prenatal? Is it prenatal and delivery? Is there a postnatal visit involved? And then what that payment would be. So we've looked at that for other states. And then we wanted to look at what is the landscape in Kentucky right now? What kind of doula services do we have? What's happening? And so we were able to do several things. We had a public meeting. We sent it to every listserv that we had in the cabinet, and that's a lot of people. And we asked them to send it to anybody on their listserv that wasn't on the listserv we sent out, and tried to get to cast a very large net so we could get anyone interested in this study to participate. So we had a public meeting where we got comments. We had a survey that we gave all of those people a link, and again asked them to send that survey to anybody that they thought would be interested in the survey so we could gather more information. We had a focus group of doulas. We had rural and urban persons that provide doula services in the state right now, and we're able to have their opinions. The focus group, both this one and the healthcare one, the second focus group we had, we did not have anybody from the cabinet attend that. That was led by the Milliman group, just so that no one felt like they were intimidated in any way by any of us being there. So we had the public meeting, we had the survey results, we had the focus group with doulas, and we had the focus group with healthcare. That was hospitals, providers, MCOs, a whole range of folks. So we accumulated all of that information, and then we pulled together an advisory group that Kelly referred to. So we wanted someone from advocacy there. We wanted a maternal fetal medicine specialist, a neonatologist, OB, peds, doulas, certified nurse midwives. I'm looking at my notes to make sure I don't forget anyone. And then advocacy. And like I said, we looked very carefully at those folks too, to be sure that we were covering rural and urban folks, to look at all of this information, and then that group was able to come up with some recommendations that will be looked at by people above me and above them, and that will be available for you to peruse by December 1st when that goes to the legislature. And I believe I covered everything. Questions? We don't have time for questions. Put questions in the chat and I'm happy to answer them.
Yes, no, that's great. And just a reminder for everyone, when these sorts of reports happen, it's not necessarily a guarantee that it will become legislation, but it does help inform policymakers on how to develop those policies so that they can hopefully develop new legislation and laws that will benefit and support more Kentuckians. So definitely stay tuned. We will continue to follow the issue closely and provide updates. Segueing over.
I see this is the start of a conversation, and now we will be able to have an informed conversation because we've got all of the information together in one place. Now we can move to that next step.
Another success of the 2024 legislative session was around immunizations access. House Bill 274, that we call the Kentucky PrEP Act, allows pharmacists to continue providing immunizations down to the age of 5. Throughout the pandemic, the federal PrEP Act allowed them to offer those immunizations down to the age of 3. So hopefully this will be kind of a seamless adoption for our pharmacists statewide, but wanted to look to you, Dr. White, on what some of our rates look like right now, why this is important, especially in cough, the respiratory season, and what that looks like moving forward.
Well, that's a perfect segue, because I'm going to make sure that I show this every time. This is coveryourcough.ky.gov. It is our respiratory virus website. This is updated every week. If you scan down to the middle, there's a green box that tells you as of October the 31st, COVID activity is low, seasonal influenza and RSV is currently low, and it mentions mycoplasma pneumonia that you may be familiar with. This gives you a place where you can click on a dashboard that will show you what it looks like in Kentucky, where our immunization coverage is high, where it's low. It gives you numbers of vaccinations that the blue is COVID-19 and the influenza is green. And you can see these numbers are quite low. disappointing, but they are quite low at this point. So this will show you also ER visits and hospitalizations if you continue to click down these little blue boxes. And that way you can see by age group what kind of outbreaks we're having, what kind of what our burden is that reflects this little green box right here. I also wanted to show you next to the green box is our DPH resources. And this is something that that our immunization team has put together. It is an excellent resource. If anybody has any questions, this is updated regularly, but it gives you information on flu, COVID-19, RSV, and pneumonia. And you can click on this and it will take you right to the CDC recommendations on what you need to know about vaccinations in Kentucky and in your household. So it is important. New things that came out is the new COVID vaccine that came out this fall. It is recommended that people over 65 and people that are immunocompromised should get a booster in 6 months. I hit both of those with my rheumatoid arthritis and my advanced age. So I will be getting, I got my shot last week and I'll be getting another one in 6 months because your immunity does tend to wane the older that we get, and taking immunosuppressive drugs. So it's really important. And like I said, that link I showed you, that's always updated with what the latest and greatest recommendations are. So we know that if you get vaccinated, you're less likely to get the infection, you're less likely to be hospitalized, the severity of your illness is less. And if you don't get COVID, then you don't get long COVID. And long COVID, I think, is going to be something that we're going to be battling for decades. I don't think we have our arms around that yet because we can't, but that's being studied very closely. So get those vaccinations to prevent illness, not only for yourself, but for those other family members, coworkers, that are anyone that is around you.
Yeah, you are so right. And just to give folks in the room a warning, especially our MCO friends, anyone else who may be a pharmacist, work with pharmacists, coordinate with pharmacists, there is going to be some communications headed your way soon related to cost and reimbursement rates. But this is specific to some federal regulations. The cost and your reimbursement rates are changing the unfortunate direction, but it is really out of the state's hands on this one. So look for some communications from the state very soon about that. And before I pass the virtual mic off to Commissioner Dennis and Child Care Director Day, I did want to give you a quick minute if you want to plug the newly announced My Healthy Kentucky Home project. Dr.
Oh,
White.
absolutely. I'm so glad that you're giving me that opportunity. Our Healthy Kentucky Home, our Healthy KY Home is a new initiative that was launched on Halloween, which is kind of an odd day, but we launched it on Halloween at the governor's press conference. And it is a program where we are going to look at the next 12 months, and every month will be a theme, and that theme is trying to encourage people that our health in Kentucky is hugely, again, I don't think that's a word either, but is very much affected by our behavioral, the things that the choices we make for ourselves. So each month is going to be recommending that you make a tweak to your lifestyle. It's not, these are the 12 things you need to do today. This is what we want you to focus on this month, and get in a habit of eating those 3 fruits and vegetables a day, being more active than you were the day before. That'll be another month. And so it's a very doable, usable program. And I'll put the website in the chat, because there is a media toolkit. What we want is, we want Kentucky Voices for Health. We want the Foundation for Healthy Kentucky. We want our local health departments. We want everybody to see this program and figure out, how do you fit into this, and how can you encourage this among the clients that you interact with every day. So I think it's very exciting. It's not, brain surgery or a hand transplant. It is the kinds of things that we need to do on a regular basis, and that we can do. we're capable of doing these things if we as a collective put our minds together and say, I can do that. I can make that change, and I can make things healthier for me and my family. So thank you for the shameless plug.
Yeah, yeah. No, new news last week, so happy to kind of give you a quick little plug for that. Back to some legislative topics, something that continues to be brought up year after year right now is the need for support around early childhood education, childcare, daycare, whatever you want to call it. We know that 90% of brain development happens before the age of 5. We know that clock doesn't begin when they're 2, 3, or 4. So we need to give more focus and attention there. And I know Commissioner Dennis, you and Director Day, whoever wants to kind of take the lead here, we had some recent reinstatement of family copay responsibilities that I think would be helpful to share. And I think you all have got some other information that was recently shared at the Families and Children's Committee, if you want to touch on that briefly.
Sure, I'll go ahead and jump in. Good afternoon, everyone. So childcare does continue to be at the forefront of a lot of conversations. And it's where it needs to be, because it's not just a family issue. It's an economic development issue. It's a workforce issue. It's everything. And so Kelly, as you mentioned, during COVID, we were able to secure some funds to pay parental copays for quite a long time. Unfortunately, that ended September 30th. So starting on October 1st, families do have to pay their parental copay. One thing that we were able to do, there was a notice of proposed rulemaking at the federal level directing states to cap family copays at 7% of that family's gross monthly income. We have done that already. We were able to go ahead and make that change. Those regs are still going through the process, but we wanted to make this as easy for our families and our providers as possible. So we've done that. We continue to pay on enrollment versus attendance, which more closely aligns with how private pay folks pay for their child care. And that is also a federal requirement. So those are two things that we were able to check off that list rather quickly. We are currently serving almost 23,000 families across the state with the Child Care Assistance Program, and that equates to almost 39,000 children. So, we're happy to see those numbers where they are. That is close to pre-pandemic days, so that is a good thing. We continue to have conversations within the business community, within child welfare about child care is a preventive measure. And as you mentioned, 90% of brain development happens between the ages of 0 and 5. And so if we are waiting until kindergarten, we're really missing the boat because those early interventions, those earlier supports just really lead to safe children, safe families, and safe communities. And that's something that a lot of you will hear me say regularly, because like I said, it's more than just a family issue. We did do a market rate survey this year, which is federally required. We are still analyzing that information to determine where we need to move or if we need to move with our provider reimbursement rate. So there will be more to come on that. Commissioner Dennis, I think I covered most of that high level quickly. One thing I did forget to mention, I'm sorry, it came to me as soon as I said that. The Kentucky Chamber of Commerce is convening a Kentucky Child Care Collaborative Group. Over 30 some entities are represented on that work group to really come up with a shared vision and mission about what the ask really needs to be around childcare and how we can get all the entities thinking about childcare in a different way and how it actually impacts all the other sectors.
Andrea, could you
Yeah.
also, I'm sorry, just a little bit about the early child care assistance program? Any updates? Or
For the early Child Care Assistance Partnership. The
I'm sorry, yes,
public-private-
yes.
Okay.
Yes, I'm sorry, yes.
So that is continuing, and as that is a public-private partnership, so that is a program that encourages employers to contribute towards their employees' childcare cost, and then the state will match that. This assistance is for families who are not eligible for the subsidy program, and the state match is based. It's up to 100% of what the employer contributes, but not less than 50%. There's some math there with the family's income in relation to the state median income. We have so far 98 approved families, and that represents about 135 children. One of the things that we're hearing is, capacity. Capacity becomes an issue of, like, if an employer wants to participate, but they're in a childcare desert, how do they make that happen? So that is where we're going to focus on how do we build that capacity. I know several of you are aware over 50 of Kentucky's counties are considered childcare deserts, meaning that there is not space for a child to attend a childcare program. So how do we address that? How do we support our family childcare network, especially in our rural communities, to empower women? Because as we know, 98% of our caretakers in childcare are women. How do we empower them to be small business owners and to open up their home or a center to provide this care and make it something that is feasible and sustainable? So we will continue to work with all of our partners. We will be thinking about how to remarket that because it is slow and steady. But there's great potential here. And a lot of states are looking to us as a leader in this of, like, how did you do it? What were some of the pitfalls? So we're having conversations regularly.
Yeah, thank you so much. And I'm gonna kind of keep us brief on this last one because we do need to pass it off. I want to give those here to answer some questions about food access plenty of time, but wanted to congratulate you all on a recent award for the Kentucky Health Information Data Sharing Project. Would love for you to speak just briefly about that, but I think you all are seeing, as far as additional caregiver supports, some really positive outcomes related to kinship care. So if you wanted to speak to that just real briefly, and then we'll get going here.
Sure, thank you. So yes, we did recently receive an award, as you shared, around Excellence in Human Services Information Sharing Technology Award. And that really has helped our frontline social workers receive timely information from our Kentucky Health Information Exchange Systems around clinical and medical services that our children in foster care are receiving. So again, before these two systems worked in silos, but now they're connected and information is automatically shared with our social workers. So it's been, that's been very exciting and something that was very much needed. And then real quickly around kinship care, in July, we implemented a new permanency outcome. It's the Federal Guardianship Assistance Program. It's what it's known across the country, but in Kentucky we call it subsidized permanent custody because we don't want to confuse it with other guardianship programs. But that's a new permanency outcome for relative to kin caregivers or friends and family care. But that will allow relatives and to have a pathway to permanency other than termination of parental rights. And at the same time, we adopted the new federal standards to streamline the process for approving relatives as foster parents. So made that process more streamlined, not as difficult as it has been in the past, and then adopted this new permanency outcome that made it less difficult for our relatives to make that decision because sometimes they did not want to proceed with that termination of parental rights for a permanency goal. So with that, we have seen an increase in March, April. We had about 14% of our children in out-of-home care that were relative foster care. And that number has increased to 22% since we implemented these changes. So that is a move in the right direction, because we know that relative care for children who have to be outside of the home is better for their overall health and well-being. It's less traumatic, it leads to more stability, and it keeps children connected to their family, their culture, and their community. So we're excited to see that that trend of relative and effective kin care increasing.
Thank you. And I think we're all kind of at the mercy of the legislature at times, but it is a contact activity. So as we get closer to that January 7th starting point for 2025, we'll definitely be having some check-ins and trying to keep everyone in this room apprised of what's going on. But I will pass the mic now to Tyler Offerman to take it over.
Thanks, Kelly. All right, y'all, I'm gonna be your pilot as we land this plane for our final section. I don't have to tell y'all anything you don't know, but the cost of food sure has gone up. So I'm happy to be able to talk with several of our friends here within the cabinet about what the state is doing to make sure food and food access programs are accessible in Kentucky. First out the gate, we're going to talk about WIC, the Special Supplemental Program for Women, Infant, and Children. In particular, some exciting announcements that are going to be rolling out next year. And a quick side note, 2024 is the 50th anniversary of WIC. And for those that don't know, the first WIC office ever opened was in Pineville, Kentucky. So as always, leading the way to make sure our people get fed. So Carrie, would you like to talk a little bit about what we're doing with WIC?
I would, and this is exciting news because we will be leading the way in adding WIC to our integrated eligibility and enrollment system. So we'll be the first state in the nation to integrate that and have it available for folks to apply online. Our kickoff meeting starts in January. We've been working with FNS to approve our APD, and they approved it last month. They're in the process of looking at our statement of work. So very excited. We think with this change, we'll increase probably enrollment in WIC for pregnant women and children.
That is awesome and a very big deal. I know there have been states who have been trying to figure this out for literally decades. So I'm very excited for our leadership in this area. And yeah, just getting more folks signed up for WIC. And regular reminder, WIC is not just for women. Any caretaker of any child under 6 who qualifies can enroll. So make sure to contact your local health department, and very soon go on to Connect to learn more. So very excited about that. Thank you. And real quick, just do we have any sense on timeline? I know things can be fluid when it comes to FNS.
It will be in 2026. So, I'm hoping the first part of 2026, but soon. So I think a year is not too bad of time to develop, test, and implement. So very excited.
Well, that's great. Cool. Well, moving away from WIC, want to hand it over to Commissioner Dennis and/or Wendy to talk a little bit about summer EBT program, continuing in the vein of Kentucky being the first. We were the first state in the South to opt to administer summer EBT this past year. I know any new program is going to have some bumps along the way, but just wanted to invite folks, since we just ended this 2023 to 2024 program, to do a little bit of debrief and then looking forward for next year.
Thank you, Tyler. We were very excited to be able to lift summer EBT for 2024 States were not required to implement summer EBT in 2024, but in Kentucky, we all recognize the value of food and what it means to families and children. So the Division of Family Support team, along with others, worked very hard to make this lift in 2024. So we did successfully implement our summer EBT program and for 2024. And during that time period, we issued for summer 2024 for summer EBT, we issued approximately around $46 million in benefits, and that served again approximately 395,000 children. So very successful program, and we are preparing for 2025. And so Wendy has some updates about where we're at for 2025.
Hello. We applied for actually a No Kids Hungry grant.
Yes.
Kentucky applied for, and we got that. So we will be, our proposal for that was to do a lot of improvements to the school admin portal to make it easier for those people to get the files uploaded and over to us to make the match easier. So we got 578 some thousand to in that a grant award to work on the school admin portal. So we were excited to get that. It will assist in verifying the enrollment and just streamline the process a little bit more. So that's on that side of it. And then as far as the rest of summer EBT for 2025, we have the POM was submitted. We got a couple comments back. The final plan isn't due until February, but we've went ahead and submitted the change requests to get that implemented on the system. It takes a long time, but there's all kinds of changes to getting the foster care file automated so we don't have to go back and forth with DAFM to make sure that those cards get issued appropriately, and lots of other changes, enhancements really to make it easier for 2025. So we're excited that, you know, we get to do it all again, but it'll be hopefully a lot easier this time.
Yeah, we could not have done this without support from our local school districts. So again, it's not just CHFS alone in this work. So KDE and our local school districts were an important partner in this, and we really appreciated the work we were able to do together. And so yeah, we're very hopeful that this technology grant that we just received will help streamline that process and make it easier for our schools, because we know that they also are very busy with everyday responsibilities. And but again, they were a very good partner and worked with us and helped us get the information that we needed to be able to launch our summer EBT program in 2024.
Great. And I know one quick tip, even if your school is a CEP school, consider applying for NSLP, the National School Lunch Program, free and reduced lunch. Filling out that application, just make sure that the school district has the most up-to-date information and you don't have to futz around updating that information later on in the school year. But any other words of advice for parents, caretakers looking forward for this summer EBT?
Wendy, anything? I mean, again, we're trying to automate and streamline as much as possible, but be patient with your school districts. I know there's a lot happening in that space. And again, they've been very good partner in helping us get this information. But Wendy, any other thoughts?
No, I can't think of any. We're trying to make sure that the people that already have cards get to use that card again. I mean, we're doing all kinds of enhancements with next year. So we tried to think of everything that was a roadblock this year and fix that. So
we learned a lot from 2024.
Yeah.
Great. Well, wonderful. Thank you for that. So our last piece, I wanted to touch on senior meals. For those that don't know, Kentucky continues to be one of the states with the higher rates of senior hunger. So our senior meals and the Department for Aging and Independent Living have been doing a lot of great work and a lot of good thinking about how to serve these Kentuckians. And I wanted to invite Commissioner Eldridge to just talk a little bit about some updates and impacts that they're seeing.
Sure. Thank you so much. And thank you to everyone that's been on here and stayed on the whole time. I appreciate your time today. So with that, we're really excited to announce that over state fiscal year 24, there were 3.4 million meals served to older adults. And that is the second highest only to the year of COVID. And what we know is that through community partnership and doing reach into underserved communities, especially to our older adults, that we can truly make a difference. Within that, we are so grateful that the governor and the General Assembly put in both of their budgets for the first time ever state general funds to the tune of $10 million each fiscal year to continue to expand senior meal nutrition and access. So we will continue to do these efforts or continue to do outreach. And I'd be remiss if I did not mention that actually on Wednesday, November 6th, we will be having our 5th annual Senior Hunger Summit. It'll be a time in which we'll have individuals from across the state, true senior nutrition experts that will be coming on and speaking to opportunities to continue to enhance and support our older adults. And here's what we know is that when older adults have their basic health needs met, they can continue to thrive and support. And it goes hand in hand with what Dr. White discussed with regard to having a healthy Kentucky home. And so I will send out that invitation to Emily, if it's okay, I'll send it to you and to Kelly or to the and Tyler, to you as well. And just make sure that you all can send it out to this community to ensure that we have everyone on to participate in the 5th annual Senior Hunger Summit. And again, thank you for bringing attention and awareness to this. It is very much a critical need as we're supporting our children, our adults, and our older adults and ensuring that they have their basic health needs met. Thank you.
Thank you, everyone. And I think, look, finished before 3:30. I'll pass it back to you, Emily.
Yeah, thank you. These were great updates, lots of good information today. I saw a lot of good questions and answers in the chat. We'll be pulling all of that together in a follow-up email. So it will be chock full of information for links, slides, recording, and evaluation, other opportunities for stakeholders. So be on the lookout for that. And thank you all very much. Have a good afternoon and make sure to vote tomorrow. Bye.